Have a very important topic coming up shortly, particularly if you're a dog owner. Would you be able to spot dental issues for a dog? So we've got Dr. Paul Manktelow on the show, who's going to give us a bit of an insight into anyone who's an owner, I suppose, even if you're not an owner of a dog, it might be worthwhile to have an idea how to spot dental issues. So, Doctor, welcome to the show. Great to have you on board. Can you give us a rundown on the research?
Yeah, absolutely. So we know that around 80% of dogs over the age of 3 will have some sort of dental disease. So it was really important for us to conduct some research. So I partnered with Purina Dental Life to look at, would owners recognise signs of dental disease in their dogs, and then what would they do? And the research was really interesting. And the first thing that stood out to me was that 30% of dog owners would ignore bad breath as a sign, and a similar number would sort of, even if they knew there was some sort of dental problem, would sort of leave it and hope that it would resolve on its own. And we know that bad breath in itself is an early warning sign of dental problems, and actually that's the point in time that you have to start intervening and doing something. Some of the other signs that you want to look for are the build-up of plaque and tartar on the teeth, that's that sort of brown staining, and also inflammation or reddening of the gums, which indicates gingivitis. Now these are all early indicators that there's bacteria and infection building up in your dog's mouth.
And what are I know obviously it's difficult to say, but what are the sort of consequences of not picking up early, Doctor? I mean, what can we do to, maybe, you mentioned there, like, look at the signs to intervene early, but what's the consequence of sort of not picking this up as early as possible?
Yeah, so obviously bad breath is an early warning sign, and that's obviously not particularly pleasant in itself, but actually what's then happening inside the mouth is that plaque and bacteria are building up. That bacteria can lead to infection, and it doesn't just stay in the mouth. Those bacteria can travel to other parts of the body, like the heart, liver and kidneys, and cause more sort of widespread systemic disease. And when those teeth get infected or start to get sort of cavities in them, you can start getting dental pain. You might notice that your dog's drooling, struggling to eat, and you can often notice behaviour changes in these dogs as well, because it's like having a toothache yourself. It's not particularly pleasant. So these are things where a really good dental regime, a preventative dental regime, would really help and support these problems becoming worse in the future. Because if you have to go to the vet to correct these problems, we all know that that can be quite costly. So prevention is much better than cure.
No, absolutely. And just, before we sort of talk about sort of some preventative strategies, is it worth kind of maybe, obviously I'm guessing, I'm not an expert in this, that, bad breath could be other things as well, but I suppose, is it sort of worth maybe checking regularly just to see if the dog has any signs of inflammation, redness, or just how often should maybe owners check to see that maybe there are signs of dental issues?
Well, I would always recommend, if you can, do regular sort of teeth brushing. We'll probably talk about that a bit later, but essentially if you're doing that, you will inherently be looking inside your dog's mouth anyway. Now there are a certain proportion of owners that tell us that they struggle to clean the dog's teeth, and if that's the case, then I would still recommend checking your dog's teeth, and at least once a week you just sort of lift up the lips either side of the mouth, and you get a good view of both of the sides of the teeth. And as I say, you're looking for this soft film plaque, you're looking for the hard brown staining, which is the tartar, and you're looking at the gum margin, that's where it meets the teeth. Now that should be a nice normal salmon pink colour in a healthy gum, but you start to get thickening or a red line around the teeth, and in severe cases you might even notice bleeding gums or infection. So at least once a week check.
Absolutely, yes. Some great point there. And in terms of preventative strategies and brushing, Doctor, I suppose, we all know the importance of brushing, flossing, and whatever else, but I suppose it doesn't cross a lot of people's minds. It doesn't sort of cross my mind what it's the best thing to do for a dog. I don't have one myself. I don't know people who do. But what are some preventative strategies? And in terms of brushing the teeth, whenever I see a dentist myself, they're always telling me to make sure you brush around like in a circle type thing and so on and so forth. But is there anything specific, any type of brush that is probably maybe potentially more effective? I mean, obviously, what type of brush possibly, how maybe do people brush, and any other strategies you can sort of share with our listeners?
Yeah, it's a really interesting point you made there, that actually we're very well aware of regular sort of oral hygiene routines are important for us, like, brushing twice a day, flossing, all that stuff is important. And it's the same, same with our dogs. So I would really recommend that you get a good pet-friendly toothpaste, and that is specifically designed for dogs, and they are often chicken or beef flavoured or meaty flavoured, so they actually taste really nice to the dog. So you're on a sort of a good starting point. Really gradually introduce brushing, very, very slowly, give them lots of reassurance and praise, and do that as early as you can, as soon as you get your dog as a pup, or even if you're acquiring an older dog. But really just at the start, putting it on your finger and just getting them used to moving around their mouth so they get used to that sensation, and then moving on to a toothbrush. Now, there are lots of pet designed toothbrushes out there that can help you get into all the nooks and crannies, but again, it's really important that you do this gently, you reassure them, and you turn it into a positive experience. Now, we know 40% of owners are brushing their dog's teeth at home, which is absolutely fantastic, but for others that are struggling a little bit, as a minimum, I would recommend a sort of a daily dental chew, one that's scientifically proven to help clean, and that's why I partnered with Dental Life, because their chew's got this sort of soft, porous texture, which is important. Now, there's a bit of a myth out there that you need a really hard chew to scrape the teeth, but we know in our own dental care, being hard and abrasive isn't good for our gums. So it's important to get something that's got some scientific backing around it and can mechanically clean the teeth, and even those back ones that are really hard to reach.
No, I could imagine. And, I was thinking, hey, it's a little bit sort of off track, Doctor, and off piste, and maybe sort of outside the scope of the conversation. But if I mentioned there, so obviously there's a high percentage of dogs who do end up having teeth issues. But what happens if a dog does lose a tooth? Just out of interest, is it similar to humans where like at a certain age it'll grow back, or is it gone for good? Does it impact the way they eat sort of going forward?
So if an adult dog loses its tooth, then it doesn't grow back. But it's really interesting because over the years I've seen quite advanced dental disease in some dogs, and some breeds of dogs seem to suffer with the teeth decay more than others, and springing to mind sort of poodles is one of them, and I've seen in severe cases where dogs have had to have most of their teeth removed. Now, it's really interesting because they actually cope very well, even eating sort of hard food, which is very strange, isn't it? But they do cope, and actually what you find is, because the teeth are infected or painful, once you remove them, they eat a lot easier, they find it a lot better, but obviously that's end stage. That's something we're trying to avoid, getting to that point, and that's why prevention is much, much better.
No, absolutely, 100%. I mean, like you've said before, it's given some good ideas in terms of strategies, and I suppose just sort of on that, different types of dog, breeds of dogs. Is that sort of in terms of like the brushing? Are they sort of? I mean, I suppose it's an individual thing, but is there any sort of? Also, probably the scope of the conversation too. But is there anything people can do? Maybe introduce brushing early on, so the dog is more familiar with the routine type thing. And is it sort of harder to brush if you leave it a long time? Maybe sort of start brushing as early on as possible.
So yeah, the earlier the better, and if you're getting a puppy, get them used to that at a very young age. But even older dogs, if you're rescuing a dog, you can build them up to it. But what I would avoid doing is going straight in there with a toothbrush with a toothpaste on it, and then expect to be able to brush the dog's teeth as you do your own. They're not going to tolerate that straight away. It has to be very, very gradual. Has to be built in with praise to build their confidence, and make sure that you're reassuring them all the way through. There are some great techniques out there. You can just look on YouTube. There's lots of people that are giving good advice on this. But the point is, it's a gradual thing will help build their confidence and make it a positive experience. I mean, my dog Rodney, as soon as I get his toothbrush out and toothpaste, he absolutely loves it. And he's wagging his tail because he knows it's going to be a nice experience for him. Having said that, I've got a limit of about a minute that I can do, and then he starts getting a little bit fed up with that thing in his mouth, and he starts chewing the toothbrush. So every dog has got their own personality and they've got their own limits, but you work with them as much as you can to have the best impact.
No, I find it really, fascinating as well, Doctor, from a psychological perspective. That sort of behaviourist sort of approach, the sort of Pavlovian type, the association the dog has to the brushing of the teeth type thing. But that's another story for another day, really. But it's really interesting. So there are different flavours of tooth paste as well, and sort of. That's really interesting stuff as well. But in terms of our listeners, if they want more information about the research, more information about where they can sort of get, look at preventative strategies and maybe look into getting different, toothpaste, toothbrush specific for dogs, is there anywhere they can go?
Yeah, absolutely. I would always recommend going to the Purina website and looking for the brand Dental Life in there, because there's lots of information about how to keep your dog's teeth sort of clean through a really easy sort of daily dental chew, and that's really, really important. But I would say that our research did show something really interesting, that a good chunk of people, about 22%, would go to the internet as their first port of call when they had an issue or identified an issue, but the majority of those ended up leaving very confused. So it's really important that you go to a good reputable destination to look at some of these things.
Absolutely. I echo those sort of sentiments across a lot of areas these days. Definitely the internet can be really useful, but sometimes it's a source of confusion as well. So you go on there and you've got so much sort of different types of suggestions, really. But yeah, absolutely, I think that's a great point, Doctor. But thanks again for your time. It's been really interesting and informative, and no doubt anyone listening who's got a dog, or maybe knows someone who has got a dog, will have found it equally as interesting and important as well. Thanks for your time, and have a great day.
Yeah, you too. Thanks for having me on the show.